Welcome to the Exam Room Live, brought to you by the Physicians Committee. Hi, I am the weight loss champion, Chuck Carroll, and this is the healthiest half hour anywhere online today. Appreciate you joining us right here on Facebook and on YouTube as we do our very best to educate and inspire for the next little while. On tap today, we are getting our first glimpse into the major changes that could be coming to the updated dietary guidelines. Going to be talking about the good and the bad and what you need to know out of this 835-page report that dropped this week. We're going to break it all down when dietitian Susan Levin joins us right here on the Exam Room Live. Susan, can't wait to catch up with you. 835 pages. We have a lot to talk about.
That's right. I'm going to read every single page. Get ready.
And Dr. Vanita Rahman is back to answer your questions as we open up the doctor's mailbag. So go ahead and submit those right now in the chat box or the comment section, whatever it is that you want to call it. If there's something nutrition or diet related on your mind, Dr. Rahman is here to answer it. Dr. Rahman, you ready to answer some questions?
Absolutely. Let's do this.
All right. I love that enthusiasm. But before we get into anything else, let's get caught up with the latest happenings. Here's a check on your health headlines for Thursday, July 16th, 2020. Coronavirus cases in the U.S. have topped 3.5 million after another near record number of new infections were reported Wednesday. More than 67,000 cases being added to the tally, a 44% increase from just 2 weeks ago. The load continues to put a strain on hospitals, which are quickly running out of room in the hardest hit areas, some of them already at capacity. The number of deaths also continuing to rise, jumping 51% over the last 14 days, with Wednesday marking the highest single-day total in more than 2 weeks, according to the New York Times. A new study suggests iron levels in your blood could play a key role in slowing the aging process. Researchers in Europe analyzed genetic data from more than 1 million people, keying in on a genome linked to long lifespan, health span, and longevity. Researchers show an especially strong link to high levels of iron, with lead researcher Dr. Paul Trimmers concluding that the findings, quote, strongly suggest that high levels of iron in the blood reduces our healthy years of life and keep these levels in check, could prevent age-related damage. Here's where it gets interesting. He further speculated that the findings may explain why very high levels of iron-rich red meat in the diet have been linked to age-related conditions such as heart disease. The study was published in the journal Nature Communications. And Starbucks is adding to its at-home plant-based options. The Coffee Giant is launching 2 new non-dairy creamers in grocery and retail stores nationwide next month. Hazelnut Latte and Caramel Macchiato, created to mimic the wildly popular drinks sold in its coffee shops. Both of them are being made using a blend of almond and oat milks. Starbucks has been steadily adding to its vegan offerings as interest in plant-based diets continues to climb. The company recently expanded its vegan menu in its 15,000 coffee shops nationwide. And following months of speculation, we are indeed getting our first glimpse at what direction health officials may be taking the country when updated dairy guidelines will be released early next year. This week, a lengthy report, 835 pages, laid out the findings that will play an enormous role in creating what essentially will become the nutrition playbook for the U.S. The good news, the frost does appear to be thawing for skeptics of plant-based diets. So here now to break down the good and the bad of what may be coming is dietitian Susan Levin from the Barnard Medical Center. Susan, thank you very much for joining us today.
Thanks for having me, Chuck.
Now, I will admit I have not read all 835 pages just yet, but what I did see, I know, right up front though, the report cites something that I found really perhaps telling as far as what direction they may be taking these things. It cites more than 70% of Americans are either overweight or obese, and referencing increasing rates of severe obesity on top of that. So what does that say about their thought process for where the current dietary guidelines are?
Well, it's interesting. The guidelines are actually not written to specifically address people who have chronic diseases. They're pretty explicit about that. So, for decades, it's been for healthy Americans, and we're just not healthy anymore. And that statistic, like you mentioned, for people who are overweight or obese, it's 70% now. People with diabetes or prediabetes, that's 33% of the population. Hypertension, half of all adults die of heart disease. So we have pretty stark statistics in this country in terms of diet-related diseases, yet our guidelines are still written technically for people who are healthy. So I do think, though, that they're giving more pause to prevention, and they are stating not only diets that actually we know work well for people who already have a chronic disease, which is most of us, but they are ideal for people who are healthy or are looking to prevent certain diseases, because that's really the conversation we need to be having, right? How do you prevent this? Or if you have it, how do you roll it back?
With that in mind, and based off of the conversations that you and I have had in recent weeks, again, based off of the data in this report, how different are we kind of expecting now these updated guidelines to be when they're released early next year?
Well, the truth is that they are kind of, and I'm actually quite grateful that this particular round of guidelines are sticking to what we know to be true, and that is that dietary cholesterol is linked to worsening heart disease risk, that saturated fat in the diet also linked to greater risk for conditions like heart disease. And these are two areas where industry has been just funding studies and trying to get into the media more about, no, saturated fat is good for you, right? Butter is back. Eggs, no problem. Dietary cholesterol is not a nutrient of concern. And these are things that are not supported by science for decades, but industry-funded research has tried to get in there and has, I think, managed to unfortunately trick some media outlets and therefore trick the public. But I'm very pleased to see it did not trick this committee of people who were looking at different dietary patterns for the report, and they stuck to what is true by saying you do not need to consume saturated fat or dietary cholesterol, and that they are linked to higher risk for certain conditions. Therefore, avoid them, minimize them, or eliminate them. So that was great. I was very glad they stuck to that in the report. They also kind of go ahead.
I was just specific to industry-funded research. As yesterday, I was just going back through and reading some of the comments that people had posted during the show, and someone was asking about the study that was released last month showing that cholesterol and saturated fat may be protective against cardiovascular disease, and was wondering why this would possibly be out there. And really, all you need to do, the first thing when you see a study that kind of raises an eyebrow, is you go to that disclosures section on there, and almost everybody who participated in this study was either receiving funding from the Beef Council or the dairy industry. I mean, just blatantly right there.
Yeah. Oh, yes. And I have to resist the urge to just not even read any further when I look at those kinds of conflicts of interest, with half of those authors having links to dairy, various dairy, not even just like one dairy company. And two, I think, had beef, as you mentioned. Others had dairy-like companies, links. So things maybe like Nestle. So it was the who's who of, and some people have patents, and that was another thing I found in there. People with patents to certain that could profit from certain outcomes. So, or maybe they write books about keto diets. You have to look at all that. But I try to give them the benefit of the doubt, because certainly there are people who have received funding from industry who go on to report unbiased findings. That wasn't the case in this study, and the lead author of that study has a history of not being very forthcoming or honest about the studies that he's referencing. I mean, that study was full of those. It was really a poor review, as it were. And I'm looking forward to some kind of response to that. I think there will be one either made public, or the editors are going to have to account for, because it was such a badly written study.
I love the fact that you knew exactly which one I was talking about right off of the bat there.
Yeah. Well,
I know that you've gone through and you've isolated some of the good and the bad from this report. But before we get to that list, which you've already posted on pcrm.org, there's another thing that I wanted to bring up with you. And this is my first time actually really diving into what's contained in one of these reports. So maybe this has been in previous years. I don't know. But it really struck to me that they reported that there is a current underconsumption of vitamin D, calcium, dietary fiber, and potassium that is of public health concern. All of those are biggies for nutrients that we've talked about on the show. Have they really gone in and specifically targeted this kind of nutrient before? As far as consumption level?
Yeah, well, I think they do they do look at consumption levels of Americans through different federal databases, including what's called NHANES, which is kind of a big one. And they see what the average American consumes. So they kind of know what we're lacking on paper. So scientifically speaking, not just a guess. And it's no big surprise that we're lacking fiber, right? Because we just don't eat enough plants, despite the constant push from the committee and the guidelines themselves to, make 3/4 of your plate plants, and ideally the whole plate, right? Because even the ambiguous protein section would be beans. So we need to be consuming more plants, more fiber, the only place to get plants. And on average, we recommend about 40 grams a day. On average, American gets about 15. That's the average. Some people get less. That's just not nearly enough to manage, to keep us at peak health. Fiber kind of, we've talked about fiber nonstop on the show, and we know fiber does everything but your taxes, right? So to get as much as possible is the goal. And then vitamin D specifically, I think a lot of us know this as well. There's no real reliable dietary source of vitamin D because that's just not its intended source. The intended source is the sun, and we tend to not be in the sun as much, or we, properly law-abiding citizens wear clothes in the sun, or we wear sunscreen, or we don't live on the equator anymore because our not so smart ancestors decided to move north and away from the equator. So we're just not getting as much vitamin D as we may need. So yes, of course, a lot of people will go to their doctor and find that out in a lab and then be prescribed or recommended to take a vitamin D supplement because, again, there's not a real reliable dietary source other than the sun. Potassium is what's found in fruits and vegetables. So if we're not getting enough fiber, we're definitely not getting enough fruits and vegetables. So you want to make sure that you're getting a good potassium source. And because we can tend to overconsume sodium and not enough potassium, this is one of the major problems with the hypertension, the rates of hypertension in this country. We need to get the sodium down, the potassium up. How do we do that? Well, we eat more colorful fruits and vegetables. And then lastly, calcium. This is a nutrient that, based on the recommended amount that is stated in this country, which is anywhere for adults around 1,000 milligrams a day, we just don't necessarily meet that bar. Some may argue that bar is too high. We don't need that much calcium in our diet if we're getting our sources from plant-based sources. So there's some evidence that if you're, that 600 milligrams might be enough for most people, without osteoporosis or other conditions. But that said, if we want to meet that calcium recommendation, then we can be doing that by eating lots of leafy greens. Beans like lentils are good sources of calcium. That's the most, greens are the most absorbable form of calcium in the diet, even more so than cow's milk, which is the primary source of calcium, unfortunately, for many Americans. And that's kind of while it does have a decent amount of calcium, it has a lot of other problems associated with it, consuming dairy products. However, if you are culturally attuned to drinking some kind of opaque white liquid, then you can do plant milks and get the same amount, or if not more, calcium from those drinks. So, trying to, I guess, make people more aware of, we do need to be eating, I would interpret it as eating more greens, eating more beans, so that we're kind of meeting all those markers, right? That's how you get the fiber. That's how you get the potassium. That's how you get the calcium. We just need to be eating more foods like that.
All right. As a reminder, if you have a question for the show, go ahead and post it in the comments section. I do want to say hi to somebody by the name of Mr. Lindsay. He has a first name of Z, which I'm not quite sure how to pronounce, but he says that Fiber Fueled is on his Amazon reading list. And sir, I guarantee you that is an amazing book. We had Dr. Will Bulsiewicz on the show not too terribly long ago. If you want to go back and watch that episode, it's a fantastic read. Susan, but based off of what it was that you were just saying and my interpretation of the report, it seems like the tide, generally speaking, may be beginning to turn for the idea of flat out promoting plant-based diets.
Yeah, I think so. I got that feeling too, Chuck. I mean, 5 years ago when the guidelines came out, it was, it put plant-based eating, and specifically it said vegetarian dietary patterns are one of the healthiest dietary patterns. And then even in this case, it went on. I mean, of course, there's been 5 more years worth of research supporting this. I mean, we can't stop this research. I was just looking at some what we call breaking medical news on the PCRM site, and just this week there were a study that came out that said people who consume more plant protein instead of animal protein live longer or have lower mortality rates. There was another study this week about eating more fruits, vegetables, and grains helps prevent type 2 diabetes. So the study, hundreds, thousands of studies that lend to this concept that plant-based dietary patterns are the healthiest dietary patterns. And even the dietary patterns that they didn't call plant-based, but they said, okay, Mediterranean dietary pattern. They go on to say, well, the reason why a Mediterranean dietary pattern is so helpful is because it is plant-based. So they just keep coming back to plant-based dietary patterns are the healthiest dietary patterns that we know of. And we know, even though the guidelines themselves don't address treatment of chronic diseases, we know they also play into that. So for people who already have type 2 diabetes, any diabetes, heart disease, including things like hypertension, people who are overweight or obese, people who are at high risk for cancer or are survivors, they just benefit from these, even though, again, the guidelines don't address those particular populations. So I'm excited to see that they absorbed all that, like 5 more years worth of research. They didn't lose their focus and get confused the way the media and the public tend to get confused. And I get it, like it's confusing. So I'm not pointing fingers necessarily, but I'm glad they stuck to the science. And I'm glad the low carb faction of people who were very loud and relatively organized this past round and had representation on the committee, an Atkins nominee and a couple of beef nominees on the committee, they still weren't able to twist the truth because the truth is too solid. Like the truth is just getting the foundation is a little too strong to bend at this point. And I'm really relieved to see that. And I truly hope, and we're going to post on our website an action alert where people can find the place to post comments about the report to the USDA and the HHS, the Health and Human Services. Those are the 2 departments that manage all of this, and ultimately get the final say of the guidelines themselves, which should come out in January, maybe December, if they're good or efficient. And I worry. I mean, I worry about this. This is where industry jumps on political appointees and says, you can't say this and you can't say that. And just to give an example, during the last report that came out 5 years ago, which was also, a 1,000-page report, had an entire section on the environment and sustainability, which many people think should be part of the nutrition conversation, is essential to the nutrition conversation. But beef openly and proudly came in and said, you absolutely cannot have a section on sustainability because it only points to the benefit of plant-based and the ultimate harm that animal production does to the environment. And the USDA absolutely backed down and said, okay, no, we're not even going to talk about it. And I thought that was really unfortunate and a real glaring lack of, pride they don't really care. They're willing to kind of just do what industry tells them sometimes. So I really want to avoid that. So getting your voice heard in this comment phase for the next 5 or 6 months could be really important. And we'll certainly be there speaking up.
All right, real quick, let's run through the good and the bad that you've highlighted in your wonderful blog on pcrm.org. Let's start with diabetes. Matter of fact, the report actually cited some research that we conducted specific to this, didn't they?
Yeah, so they did cite one of Dr. Barnard's and our own Hannah Kaliova, who has been on the show many times because she just can't stop doing research. She truly is some kind of prodigy. One of their studies was referenced, which was great. And the study referenced was part of a body of studies that showed high carb, plant-based diets are truly beneficial in terms of things like biomarkers or comorbidities of being overweight or obese. So it was really great to see that included. And they included a lot of great studies to come to that ultimate conclusion. So that was good. Gave a thumbs up to that.
Cholesterol, that's another big one. That's a big topic of conversation on this show. So I would imagine, this is just one show. Now we're talking about major dietary guidelines. That also has to be a biggie. What do we know as far as which direction they're leaning as far as lowering high cholesterol?
Yeah, so they're looking mostly at saturated fat, which when you consume too much or any saturated fat, your body responds by overproducing even more so cholesterol. So our body's already overproduced cholesterol. That's just what it does. We made a deal with nature a long time ago. That's not a problem because we're going to eat so much fiber. It's not going to be an issue. But what have we done instead over the years is we've reduced our fiber intake and we've upped our saturated fat intake, and our bodies are responding by having too high levels of what we call bad cholesterol, LDL cholesterol. So it's acknowledging that best to keep your saturated fat to a minimum, which is right on. And that it also acknowledges that dietary cholesterol plays a role in that as well, which a lot of people have tried to confuse people. There have been studies that can manipulate certain findings with dietary cholesterol, mostly funded by egg, of course, the densest source of cholesterol. But they didn't fall for that. So they're warning against consuming too much dietary cholesterol as well.
And one more under the good category here. It seems as though they're continuing to put distance between healthy diets and red and processed meat, saying you really should be getting this off of your plate.
Yeah, right. So this is right in line with most other organizations around the world, and even here with the latest from the American Cancer Society that said that does not have a place in your diet, in a healthy diet, red and processed meat. There's just no good news about red and processed meat, despite what beef and meat and industry how they try to spin it. And I've seen some very interesting spins in response to this report. Very interesting. It's like, wow, you really do see what you want to see, even though they blatantly said that these products are bad for you. So I did the control F function for processed meat products, and it was mentioned 40 times in the text in the body of the paper, and every time was negative. So I was really glad to see that. That didn't exactly happen last time. Last time they did that thing where they get a little schizophrenic, where they say, and contradictory, where they say, oh yeah, red and processed meat is linked to certain forms of cancer. And then somewhere else they say, oh, this can be a part of your diet, processed meat. It's like, what are you saying here? Cigarettes cause cancer, but you can have one. But this time they were more consistent with processed meat products. I was really happy red and processed meat. So I was really happy to see that as well.
All right, that's all very good. Let's talk about one area where there might still be room for improvement. And to me, that appears still to be dairy. Yes. What are we gleaning from this report as far as what direction the guidelines may be going in that department?
Yeah, so they continue to just forge ahead with recommending dairy products. And I had hoped, with caution, that they would follow what Canada had done, which was to finally admit that dairy might be for some people, but it might not. And what the AMA had recommended in a recent resolution, which was that dairy products should be optional because they make a huge portion of our population very sick in a very obvious way with lactose intolerance, which is, of course, the human norm. And we've talked about this. And, you know, this is just how humans are meant to be. They're not meant to digest milk after weaning. And the segment of the population that has morphed, has this morphed enzyme where they can actually digest milk after weaning is a very small portion of the human population across the world. And as our country is more and more not homogenous Northern European white population, we have to acknowledge that this is not a product that most people should be consuming. And of course, we would say no one should be consuming just because you have this deformed enzyme that can actually break down milk after a certain age. Doesn't mean you need it. It's still linked to prostate cancer. It's still linked to breast cancer, and ovarian cancer, asthma, cognitive decline. I mean, it's linked to so many things. Like why would you want to even drink this, even if you can break down the enzyme of lactose without getting sick directly with lactose intolerance? Anyway, so we still want to fight this, and we're not alone. There was a huge showing at the dietary guidelines when they provided oral comments from groups who were like, enough is enough with the dairy. We don't need it. It's making certain populations sick, especially among certain communities like the Black community, Native American community, Asian American community, Latinos. I mean, like it's just time. It's time to say, okay, enough is enough with this dairy. We'll make it optional is kind of best case scenario probably for the USDA, who's also in charge of promoting dairy. But you know, ideally one day they would just say you don't need it at all. And it can make you sick. It can cause cancer, and it can also cause all these other things. So we're going to work on that because we do think there's room for that to happen. I think just acknowledging everyone should benefit from the dietary guidelines, not just a certain homogenous portion of the population. So we're going to keep working on that, and maybe in 5 years we'll see some change in that area.
Well said. And I think that Michael in the comment section right now, he kind of sums it up best for what I think a lot of people are feeling. He says, all I can remember from dairy is the mucus and nasal drip. Yuck. And yes, sir, you are absolutely right about that, Michael. Susan, real quick, in 30 seconds or less, what are the next steps here?
I think the next steps are to weigh in with public comments at the dietaryguidelines.gov. You can post your comments in response to the report before, let the USDA know you're watching and make them accountable to the science. So if you could do that, you can go to pcrm.org and find links to all our information about the dietary guidelines. So get your voice heard.
All right, Susan Levin, appreciate you very much. We'll talk to you again soon.
Okay, thank you.
All right. And if you would like to make an appointment to visit with Susan at the Barnard Medical Center, you can do that and not even need to leave the comfort of your own home. All you need to do is head over to barnardmedical.org or pick up the phone and call 202-527-7500. Schedule an appointment with any one of our wonderful doctors and dietitians there that can really help take your health to that next level. I call that next level vegan. That's exactly what they can do. Or they can help you just get started on your weight loss journey, and they can even be your primary care physicians. barnardmedical.org or 202-527-7500. If you live in California, New York, Washington, D.C., Maryland, Virginia, Missouri, Arizona, Colorado, Massachusetts, or Kentucky, go ahead and make that appointment today. We are trying to add as many states as quickly as possible to that list. So if you're not in one of those locations, don't worry. We're going to try to reach you soon. All right, now you've been posting your questions all show long, and now it is time to bring Dr. Vanita Rahman into the exam room as we open up the doctor's mailbag. Dr. Rahman, thank you so very much for waiting so patiently.
Oh, no, it's all good information. Thanks, Chuck.
All right. So if you do have a question, keep on posting it in the chat box or the comment section, and we will get to as many as we possibly can before the end of the show. The first question, Dr. Rahman, comes to us from Rhonda. She's got a question about type 1.5 diabetes. She said, what can a type 1.5 diabetic do to get off of a small amount of insulin? She says she's using 8 units a day for long-acting insulin. Is this even possible?
So really important question here. Let me explain this to our viewers who may not know what type 1.5 is. So when we're talking about diabetes, we're talking about a condition where blood sugar levels remain elevated. And there are several types of diabetes. Traditionally, it's been type 1 or type 2. Type 1 diabetes is when our bodies produce autoantibodies that destroy parts of the pancreas that produce insulin. And it usually, traditionally, would be diagnosed in young children. They would develop diabetes and would need lifelong insulin. Type 2 diabetes is different in that it's not so much autoimmune, but a disease of diet and lifestyle. And with time, if we're not eating a healthy diet or carrying extra weight, or we have a genetic predisposition, all these come together to create this perfect storm, if you will, where we develop type 2 diabetes, where we develop insulin resistance. So our pancreas produces insulin, but it just doesn't do its job. And later it may produce less insulin. So these individuals traditionally would be treated with oral medications, but with time, they may need insulin if oral medications aren't enough, or if their pancreas also stop producing insulin. Now, type 1.5, what that means is, well, let me backtrack. Type 1 was usually diagnosed in children. Type 2 traditionally diagnosed in middle-aged and older adults. But now we're seeing younger and younger adults being diagnosed with type 2 and even children because our lifestyle and diet has changed so much. And one thing we also see is certain adults, when we diagnose them with diabetes, they actually have type 1 diabetes, meaning their pancreas isn't producing insulin because of an autoimmune disease, not necessarily because of the diet and lifestyle. And that's what we call type 1.5, that it's a really type 1 that's being diagnosed in adulthood. So all type 1 diabetics, whether they're children or adults, will need lifelong insulin. And the reason for that is their pancreas just doesn't produce insulin, and without insulin, our body simply can't function. So they need some insulin to come from medication. But here's the good news. If they can change their diet, and especially sticking with a low-fat plant-based diet, the amount of insulin that they need goes way, way down. So even though they need it, they can decrease it. So to answer our viewer's question, if you're on 8 units a day, that's pretty low for someone with type 1 diabetes. You may be able to reduce it more, possibly by really tightening your diet, making sure it's low-fat plant-based. But, you will always need some amount of insulin. That's been our experience so far.
All right, great question comes to us from Beatrice at 1219. She wants to know, can you still get your daily dose of vitamin D if the sky is overcast?
So great question. So vitamin D is produced by cells in our skins when they're exposed to UV rays, and a lot of things interfere with that process, whether it's clouds in the sky, the time of day when the UV rays are strongest, we will produce more. When it's less, evenings or early mornings will produce less, whether we're wearing sunscreen, how much of our skin is covered up. So presumably we can still produce some, but it's hard to quantify and say how much or how much it's decreased by.
All right. Question 1226. This one comes from Susan after we were chewing the fat, talking about the dietary report here. How many grams of daily total fat and saturated fat should we be eating?
Yeah, really important question. So here's the important part. We should really minimize our intake of both fat and especially saturated fat. So what does that really mean? It means when you look at the calories you're consuming, you want to limit your fat intake to less than 10% of your daily calories. And that doesn't mean you need to go out there and count fat and calories. That's tedious and just, not fun at all. Instead, when you're picking your food, look at the nutrition label. If a serving has less than 2 to 3 grams of fat per serving, that's usually a healthier option than something that has more. And then really avoid foods with high amounts of saturated fat. We need to keep our intake of saturated fat as low as possible. And usually, traditionally, saturated fat is very high in red meats, dairy products, and there's always some present in poultry and seafood as well. So we really want to lower our amount of saturated fat and minimize the amount of fat we consume also.
All right, here's another one. We get questions about B12 quite a bit. So here's one from Nulufar on Facebook. It says, hi, Dr. Rahman, all the way from Dallas. They want to know, is a sublingual B12 with a dosage of 2.5 milligrams per week enough? Is that sufficient?
Yeah, so the amount of B12 we need is really tiny. We need 2.4 micrograms a day. That's very tiny. And most of the oral pills out there are about 250 or 500 micrograms. So plenty. The good thing about B12 is it's usually not toxic in higher doses. So if you take it once a week or several times a week, it should be enough. But I would also recommend talking to your healthcare provider and ask them to check your B12 level. It's a simple blood test. We can check your levels, and then we know that you're getting enough.
All right. Here's a question about diabetics and fasting. Hadn't even thought about this one. So thank you to Julie on YouTube for sending this one. And how do you fast if you are diabetic?
Yeah. So, Julie, it really depends on the type of diabetes you have. If you have type 1, which is the kind where you need insulin, you really have to talk to your healthcare provider or endocrinologist to adjust your insulin levels if you're fasting, because you always need some insulin. But if you're not eating and you don't reduce your insulin, you will develop hypoglycemia or low blood sugar, which can be dangerous. Same thing can be said for people with type 2 diabetes who take insulin or certain medications that increase insulin production, like glipizide. We encourage you to really talk to your healthcare provider if you're fasting to see if your medications need to be adjusted. For others, there's a bit more wiggle room. The best thing to do is, if you're fasting, check your blood sugars. If they're starting to go low, reach out to your healthcare provider and make sure you don't get too low, because the real danger here is hypoglycemia, which can be life-threatening.
All right, here's a really interesting question from Robin on YouTube. She writes, I heard that if you consume over 50% of cooked foods in your diet, it triggers an immune response. Could that be why someone is having trouble losing weight?
Yeah, Robin, I'm not sure if that's accurate. So what's most important is what's on our plate. Less important is whether it's cooked or raw. So, getting those fruits, vegetables, legumes, whole grains, all those key plant-based foods is really important. And whether they're cooked or raw, I don't think matters as much as that they're on your plate, because we know the average American isn't consuming enough of any of these. So we really want to get those. Now, but to your point, if you're having trouble losing weight, there's a lot that goes into it. Really keeping the food low fat, eating sensible portion sizes, sticking with plant-based. So it's a combination of things, unlikely to just be the fact that they're cooked.
All right, time for just a couple more questions. Interesting one, kind of specific from Robin Lee at 1216. Nonetheless, I think it's a really important question. She writes, I had a skin cancer spot removed yesterday and was told not to be in the sun. I was also put on mega doses of vitamin D by my primary care physician, who happens to be whole food plant-based. But numbers have hardly improved. Any suggestions around boosting her vitamin D levels? My goodness gracious, I can't talk.
Yeah. So Robin Lee, first of all, I hope you recover quickly from your procedure. And secondly, about your vitamin D deficiency. So we see this so commonly, and some people have severe vitamin D deficiency with really low levels. And we will often give them high doses, like 50,000 international units for a week for 8 weeks. And then we recheck. But if you've done that and your levels are still low, it's really important to talk to your healthcare provider to see if there's any kind of medical condition that could be preventing you from absorbing it, and they can do an evaluation looking for secondary causes. But I would recommend working with your healthcare provider if your levels aren't increasing despite adequate treatment.
All right. I said hi to Mr. Lindsay earlier in the show. He said, my friends call me Zuzu. So hi, Zuzu. Thanks for watching. Final question comes to us from Harper Health in Arizona at 1217. Wants to know, Dr. Rahman, what are your thoughts on seitan?
Oh, so seitan is great. It's a plant-based food, and it's marketed as a meat alternative, but it's much healthier than, say, some of the fake meats out there. So it can be low fat. The key there is just look at the nutrition label, look at the ingredients, check the sodium content. You want to make sure it doesn't have more sodium than calories, but otherwise, go ahead, enjoy it.
All right, follow-up question for me. Is it seitan or is it seitan? Like, which one is it? I've heard it pronounced both ways so many times.
Yeah, I think this is like the potato or potato, you can pick.
All right. I need everybody to weigh in on this. Is it seitan or is it seitan? Go ahead and let me know. Just put that in the comment box. Help us out here. Potato, seitan. Like, just help me help you. All right, Dr. Rahman, thank you so very much for your time today. Appreciate your wisdom as always.
Thank you, Chuck.
All right. And if we did not get to your question today, fear not. As always, we do save each and every one that comes in, and we will do our best to get you an answer on an upcoming episode. You can keep posting that in the chat or comment box, or send them to us on Twitter or Instagram using the hashtag Exam Room Podcast. Now, also out today is a new episode of the Exam Room Podcast over on Apple Podcast or Spotify, wherever shows are available. Had a really interesting conversation with Dr. Jia Zhu, who's been in Beijing since the beginning of the pandemic. So I got an update from him on how life is going over there. And the conversation really turned to something that really surprised me a little bit, was how he was talking about the growing number of people in China who are now turning to a plant-based diet because of the pandemic, as well as international influence. He said that a lot of people now might be a little bit more skeptical of eating meat because of the outbreaks that we've seen in meat markets, obviously where COVID-19 originated, but then also more recently in seafood markets. Dr. Barnard has been talking on the show about outbreaks, the virus being found on shrimp and on salmon over there. And Dr. Zhu was very plugged into that. So we spoke about that and all of these new plant-based foods that are appearing in grocery stores. So a very healthy trend, and also thousands taking the 21-day vegan kickstart over there in China as well. So just a phenomenal conversation, really enlightening, a positive, great update from China. So check that out. Look for the Exam Room Podcast on Apple Podcast and Spotify, Stitcher, wherever the finest shows are available. And please hit that subscribe button and leave a 5-star rating. For today, that is going to wrap things up for us. Dr. Barnard will be back on the show tomorrow. So be back here at noon Eastern, right here on Facebook and on YouTube. My thanks to the crew behind the scenes that makes all of the magic happen, our director, Donna Steele, and producer, Laura Anderson. And on behalf of Dr. Rahman and Susan Levin and everyone here at the Physicians Committee, I am the weight loss champion, Chuck Carroll. Thanks so very much for watching today. And until tomorrow, please remember to stay safe, take a stand, and keep it plant-based.